Hi, I'm Warner Brock, and I'm a physical therapist with over 35 years of experience treating orthopedic, sports, and spine injuries. I'm a founder of Linear Therapy in Motion, a private practice whose goal is to help people get well, stay well, and continue to enjoy life. This week, I wanted to talk about some new physical therapy treatments for tendinitis. And I think we'll start with talking about tendinitis in the elbow, which can occur either on the outside portion of the elbow, very common, called tennis elbow, or lateral epicondylitis, or it can also happen on the inside part of the elbow, and that would be called golfer's elbow or medial epicondylitis. And now, the tendinitis that occurs is an inflammation in the tendon. And it can be either what they call acute inflammation, or it can be what we call chronic inflammation. Acute inflammation would be an inflammation which has caused painful swelling in the area. Most of the time, tendinitises that occur in the elbow are not acute inflammation unless the person has, for example, struck the elbow against something, hit it with an object, and you can actually see swelling in the area. Most of the time in cases of elbow tendinitis, you don't see any redness, you don't see any swelling. You can just see that the person is having some discomfort and pain in that area. So in general, what I see with elbow tendinitis is 99.9% of cases are generally chronic inflammation, and the treatments that you would use for acute inflammation, say for example ice or rest or a compression wrap or something like that, while they may relieve the pain temporarily, it's not going to help the condition to resolve itself and heal in an appropriate manner. And so it just continues to happen over and over and over again. We see this in athletes or people who have to do repetitive jobs with their arms and hands. And what happens is you develop a chronic inflammation in the tendons which connect these muscles here to the bones in the elbow. And a chronic inflammation, what you have is a condition where the inflammation is just in the tissue and it's just smoldering, it's just festering in there. The healing is not occurring. You just have this chronic festering inflammation, and the treatments that are necessary are something that will get the blood flow actually back into the area and allow the tissue to heal, which is going to be different from treatments that we use for chronic inflammation, or acute inflammation. With acute inflammation, you want to slow the blood flow down. You want to reduce the swelling. With chronic inflammation, we actually want to stir things up a little bit. We want to get the blood flow going. We want to get those healing cells into the tissues that are going to rebuild and regenerate that damaged tissue. And I want to show you a few things that we do now with, say, lateral epicondylitis or tennis elbow that will address the chronic inflammatory components and actually allow the tissue to heal and get a good quality repair so that you can get back to the activities that you want to be able to do. One of the treatments that we found to be very effective with cases of chronic tendinitis in the lateral epicondyle, or the outside of the elbow, is trigger point dry needling. We have some muscles that typically will contain trigger points in and around the elbow. Usually what I find is down the tricep muscle, along the outside of the humerus, you'll find a trigger point in there. You can find some trigger points in the wrist extensor muscles and in this thick muscle right here known as the brachioradialis. And usually if we find a trigger point in there, that muscle is under twice as much tension as a regular muscle, and it's applying constant tension to that tendon right there and keeping it inflamed. So what we do is we'll just use a very small acupuncture needle, and we can take and just locate the trigger point. We we can insert the acupuncture needle into the trigger point, and just by touching that trigger point, it will release it, and then we just pull the needle out, or sometimes we apply a little electrical stimulation to deactivate the trigger point. And a lot of times you get some immediate, dramatic, and lasting improvement in the pain and the symptoms just by getting rid of the trigger points in the elbow. Another new treatment that we like to do, which is very effective at getting rid of the chronic inflammation and helping the tissue to regenerate, is a treatment called A-stim, where we use some specially engineered acrylic instruments. And using an emollient applied to the skin, we glide the instruments in various directions. We have a protocol that we follow, okay? And what it causes is the body to release red blood cells and platelet-derived growth factor into that inflamed tissue to get the tissue to regenerate. But the A-stim instruments are one of the treatments that we have that are truly regenerative in nature. Now, once we reduce the trigger points in the area and we get the blood flow going with the modalities that we've talked about, the other thing we like to do is we like to begin stretching and strengthening of the affected tissue. And one of the things that we have started doing now is using what's called a flossing technique, where we use an elastic wrap and we actually wrap it around and compress the tissue, and then while the elastic wrap is in place, we begin some of the stretching exercises again to get the blood flow to start flowing. If you can imagine, if I look at muscle and tendon tissue under a microscope, it sort of looks like if you take a grapefruit and slice it in half, and you've got all of those little compartments in there. So the muscles and tendons are the same way. If you look at them under the microscope, by using the elastic wrap and compressing that tissue, it's sort of like wringing out the grapefruit and just getting the blood flow going a little bit more than just stretching alone. And then finally, when we start our strengthening program, we have to remember that because the tissue is compromised, we're not able to use heavy weights to do our strengthening. That is a problem, because we know that unless you're able to use heavy weights, you really can't strengthen the strength, the power muscles, the type of muscles that you want to strengthen in the case of the tendinitis. So we've got a way to hack the body now, and it's called blood flow restriction training. We use a computerized device to cut off the blood flow to the extremity by about 50% in the arms. All right, that's all it does. It's going to restrict the blood flow by 50%. And then, because now the muscles are going to fatigue very rapidly, we can use very light weight and still get the same effects as if we were using a heavy weight. And we just have a protocol that we would follow for the elbow. The other benefit of using the blood flow restriction training in cases of chronic tendinitis is that it causes the body to release growth factors into that extremity, which are also truly regenerative. So I hope this video provides you with a little bit of insight into some of the newer treatments for chronic inflammation and chronic tendinitis in general, and elbow tendinitis, whether it be lateral epicondylitis, medial epicondylitis in particular. Thanks for joining us this week, and if you found this information helpful, please hit the like button, subscribe to the channel for future updates, and I will see you next time.